Afternoon, everyone. Before we begin today, I want to honor Toledo police officer Brandon Stalker. He was killed in the line of duty yesterday. Officer Stalker was shot and killed when a man exited his home after a standoff and opened fire on law enforcement. The officer, just 24 years of age, joined the Toledo Police Department in 2018. He leaves behind a 7-year-old daughter, a 3-month-old son, and other family members. Our hearts go out to them, to his comrades in arms, and to Chief Krall and his colleagues in the Toledo Police Department. This is the second Toledo police officer killed in the line of duty in just the last 6 months. I was also notified several hours ago about the death of a correction officer from the Ohio Department of Rehabilitation and Correction. Jermaine Shelby, 42, died from COVID on Saturday. He'd worked at the London Correctional Institution for 22 years, well-liked, well-respected by his colleagues. So if we could pause for a moment of silence for both Officer Stalker and Mr. Shelby. Thank you. I'm pleased to announce that today that I'm naming former Ohio Supreme Court Justice Judith French as Director of the Ohio Department of Insurance. I want to thank Tanisha Dorsey, who has been serving as the interim director at the department since August. I thank her for serving as interim director and thank her for her many, many years of service and her leadership. Well, today is a exciting day for us as we begin vaccinating the elderly members of our state. We start this week with those 80 years of age and older as part of what we're calling Phase 1B. Our oldest Ohioans, we know, throughout this COVID have been the most vulnerable. By beginning these vaccinations today, we are protecting them and taking another step on the road to recovery. We're going to first go to Jamestown, Kettering Health Network's vaccine clinic at the Jamestown Health Center in Greene County. Dr. Kevin Sherritt and Mrs. Creamer, how are you both doing?
Never better. How are you, Iola?
I'm fine.
Mrs. Creamer, you want to tell everybody how old you are?
I was 101 years old last October.
And you had quite a celebration for your 100th.
Did you have quite a celebration?
Celebration for your 100th.
As much as I did for my 100th one.
Dr. Sherritt, how are things going?
Hey, never better. It's a beautiful day here in Jamestown, and our staff is here. I don't know if you can see them, but we are so excited for this day, the first day that we can begin our offensive fight against this virus that has just changed our lives. So we are humbled and honored and proud to be a part of this, and we thank you and your team and all the efforts that you have made to make this possible.
Well, we want to thank you, Dr. Sherritt. I know you head up the rural health group at Kettering, and you're reaching out to rural parts of the state, so we appreciate that very, very much. And we're going to watch you. Mrs. Creamer, you ready to go?
Yep.
All right. Kevin, Dr. Sherritt, you want to do this?
Here we go. You ready?
Mm-hmm.
Okay, down the hatch.
All right. Mrs. Creamer, how you doing? So far, so good?
So far, so good? Did you feel it?
Mm-hmm.
You did feel it. You're supposed to say no, didn't feel it.
It didn't hurt.
She said it didn't hurt. For the record, it did not hurt.
Well, let's go over Dr. Brunsman. How are you doing today?
Fine, thank you.
And you've got Mr. McDaniel there, Alfred McDaniel. And I think Mr. McDaniel is 98. Is that correct?
That is correct.
All right. Well, you ready, Mr. McDaniel? You ready to do it? Looks like he's ready.
Let's roll your sleeve up here. There we go. Little stick. And there you go.
All right.
Thank you.
You doing okay,
That
Mr. McDaniel?
Was it?
No, I didn't, I just felt just a ting. I don't know. I
All
didn't
right.
feel a shock.
Well, thank you all very much. And Jamestown Kettering Health Network team, thank you. Appreciate it. Both doctors.
Thank you.
Appreciate it very much. Okay, we're going to go up northwest Ohio to Wood County. And I think we have Deputy Health Commissioner Amy Jones. How are you doing?
I am well this afternoon, Governor. How are you?
Well, I think you're in a private home, aren't you? Is that right?
We are here with Mrs. Andahar. She is going to be getting her vaccine today.
Well, Mrs. Andahar, how are you doing today?
Fine, thank you.
Well, Commissioner, can you tell us a little bit about, how you're doing? It looks like you're doing some actually home visiting. You want to tell us about that?
That's correct. We're working closely with the Wood County Committee on Aging, which of course has existing relationships with many of the people who will be serving in the first week of this phase 1B. And we want to make sure that we're connecting to some of the seniors that are homebound or may have limited access to transportation, so that we're doing what we need to do to get them vaccinated, whether that be in their home or at a clinic.
Well, that sounds great. Ms. Andahar, are you ready to go? Ready to do it? All right, we'll watch you.
Sure. Can I feel a poke? And you're done. That's it.
Yes, quick.
Pretty quick?
And we're done.
Well, we appreciate it very, very much. It's great. Commissioner, you want to tell us a little bit about how things are going this week? I know you're really just getting started, but have you had a lot of interest in the vaccine, I assume?
We've had several people calling, emailing us, but yes, the people that want the vaccine is a huge number out there. We just need, of course, the vaccine to do it. As you know, we've got more people interested in the vaccine than we have vaccine available. So yes, there's definite interest for this vaccine. We just need it.
All right. Ms. Andahar, thank you very much. We appreciate it.
And thank you.
Good to be with you today. We're going to go southeast Ohio now. Athens County, Dr. Ken Johnson will vaccinate 104-year-old Alfred Crow. How you all doing today?
We're doing great, Governor. How are you today?
Well, I'm well. I'm well. It's
Chris Jones from the Health Department will be vaccinating.
oh, okay,
the
good.
Crow.
Very, very good.
Into the government?
Mr. Crow, how you doing?
Well, doing better. At least on the road to some protection.
I'll give you some protection. That is great. Crystal, how are you doing today? Things going all right?
Things are going great, thank you.
And we got Athens County. I assume we have a lot of interest in this vaccine with our 80-year-olds and older.
We have had an excellent response from our community.
No, that's great. Doctor, anything else you want to add? We appreciate it.
If I could say, Ohio University and its Heritage College of Osteopathic Medicine have partnered with the Athens City County Public Health Department to distribute vaccines. This week here, we'll be doing a clinic of 500 in this space. So we're so proud and honored to be part of now being proactive against this disease and part of the history of fighting it. So I'm so honored and proud of the partnership we've had together here.
So that's great. Tell us exactly where you are, because this is where the clinic, and tell us when the clinic is.
Yes, so we are in Heritage Hall. It's the new medical school's educational facility, and we offered it in partnership with the Athens City County Public Health. Due to the size of the space here, we have the commissioner with us as well. This space here allows us to have 60 people in observation after they're on vaccination, and also a very large private space for them to get their vaccinations. We've had a very vibrant response from the community, particularly 65 and over, in wanting to get vaccinated. And our partnership together allows us to do a large volume in a short period of time.
So that's great. Well, just to tell everyone, the public, you may not have been able to get in this week, but next week, basically the same places are going to have the vaccine. So people will have an opportunity again next week to try to sign up. So we appreciate it. Good to be with you. Thank you very much. Let me again repeat who is currently eligible to receive the vaccination on phase 1B rolling. Right now, we're limited to those age 80 years of age and above. For those 80 years old and older, you can find out what providers have COVID-19 vaccine near you by going to coronavirus.ohio.gov and clicking on the COVID-19 vaccination provider location button in the banner. On this page, you'll be able to search by county or by zip code to see the providers that received a vaccine allocation this week. Page also contains contact information for the providers. Each provider will do their own scheduling, so you'll need to contact them to find out that scheduling process. And again, if your provider is filled up already this week, if that's what you find, in almost every case, I think they will have additional vaccine next week, and we will continue to push this vaccine out just as quickly as we get it. So this is another week of moving forward with the vaccine, that we are now on offense. We like being on offense a lot. Today, we're seeing one of the most vulnerable groups of our population, and that is those over the age of 80. And we know that age is a big determination, determines to a great extent outcome statistically. Again, our goals are three. Number one, to save lives. Number two, to get our kids back in school by March 1. And number three, to protect our healthcare workers. On the last thing, protecting our healthcare workers, we're finding most hospitals are finished. There's a few that are just now finishing. We are still, some of our local health departments are still reaching out to a few of our doctors and nurses in the community that would qualify. But that part of it, reaching out to our healthcare community, is almost done. Let me go now. Let me talk a little bit about the conversation we had on Sunday with General Perna. And this just to try to give you some idea of what is coming. It was his belief that we would not see any reduction in vaccine, but it would probably be level for the next several weeks, that we would then see it go up a little bit. And the first major break that he could see would be in possibly March, when Johnson & Johnson vaccine may be ready and be approved and out on the market. And so we hope to start receiving Johnson & Johnson in March. Again, we'll keep you informed about that. The advantage of Johnson & Johnson, of course, it'll be one shot. And that's, again, that's a force multiplier, certainly there. A report on our nursing homes as of by tonight, every single nursing home in the state will have received the vaccine for the first time. A number of them have already received the vaccine for the second time. Some of our assisted livings have been started and others will be started in the very, very near future. So again, a very vulnerable population. Over 50% of the deaths have come in nursing homes. We're moving on that. First dose is done by tonight. Last 4 are being done today, and then that takes care of that for the first dose. And they're already started and are significantly into the second dose as well. So that's very, very good news. Eric, you want to put our chart up? I had our team run the data again this weekend as far as the deaths. And again, this is really what informs us. And I know sometimes people are saying, well, why are you doing it this way? Why are you going it by age? And age is just the best predictor, sadly, of possibility of death if you get the COVID. So 80 and above constitutes 53% of our deaths. 75, 79 is 14%. 70, 74 is 12%. And 65 to 69 is 8%. So you can see the great bulk is in this group that we are working on now. Next week, we will add people who are 75 and older. Again, that goes all the way up, though. If you're over 80, you're still eligible, obviously, next week. And we know that the majority of people who are 80 did not get it this week, will not be able to get it this week because of the supply. We've also talked about medically high-risk Ohioans who are under the age of 65. And we've carved out this group of individuals, and we want to talk a little bit in more detail today in regard to this group. And Eric, if you can put that slide up, well, that shows that group. Next week, not this week, next week, we will open vaccinations for those Ohioans with severe congenital, developmental, or early onset medical disorders that makes them particularly vulnerable. We have divided this group of individuals, and Dr. Vanderhoff will go through this and we'll list all the different items that are listed here of people who qualify. But I want to say this very carefully. We've divided this group, and here's how we've divided. And again, this whole group was picked because of their risk of death if they got the COVID, high risk of death if they got the COVID. That's why this group was picked, signaled out by the medical professionals. We have taken this group, and everyone in the group will be able to get the vaccine at some point, but we've divided this group, and here's how we have divided it. And again, the division that we're making is based upon likelihood of death if they get it. So the first group will be those Ohioans with severe congenital, developmental, or early onset medical disorders that makes them particularly vulnerable, and who have a developmental or intellectual disability. Who have a developmental or intellectual disability. For those persons with an intellectual or developmental disability and one of these conditions, your local county developmental disabilities board will reach out to you. Let me again say that. For those with an intellectual or developmental disability and one of these conditions, your local county developmental disability board will reach out to you to help coordinate receipt of the vaccination. Again, these individuals will be contacted by their local county developmental disabilities board. Local health departments and our state's children's hospitals have agreed to work with our boards of developmental disabilities to help coordinate these vaccinations for some of our most vulnerable residents. In 3 weeks, so this will start this coming week for these individuals. In 3 weeks, the week of February 15th, People who have any of these conditions and do not have an intellectual or developmental disability will be eligible to receive the vaccine. As we lead up to that, further guidance will be forthcoming as we get closer to that date. Dr. Vanderhoff is joining us now to talk more about this group of medically fragile Ohioans. Doctor?
Thank you, Governor. Well, as you noted, for quite some time, we've spoken to the fact that the risk of dying from COVID-19 increases greatly as we age. But we've also recognized that, as you said, there are some conditions that begin earlier in life and are also associated with severe COVID illness in younger adults. So to identify these conditions, we looked to the CDC for guidance. And beginning with the CDC's list of pediatric medical conditions, we focused on those conditions that persist into young adulthood and have strong evidence of risk. The result is the Ohio 1B list for severe congenital, developmental, or early onset medical disorders that the governor referenced. Now, just as we began our 1B vaccinations with those 80 plus because they're at the very highest risk among seniors, and then are moving to other seniors, so we'll begin vaccinations for this group with those who have the developmental and intellectual disabilities the governor referenced, plus one of the conditions on this list. And the reason for that is that it is those on this list who also have these disabilities who appear to have the greatest risk within this group. Again, when it's time for these individuals, those who have been identified with developmental or intellectual disabilities, to receive their vaccine, they'll hear from their Board of Developmental Disabilities. They will receive outreach. Again, individuals who qualify for this highest risk can depend on that outreach. But in a few weeks, as the governor noted, we'll open 1B vaccinations to the rest on the list. And of course, more guidance will be forthcoming. Finally, just a couple of quick reminders about our vaccines. These vaccines, in accordance with the CDC guidelines, are only available to people who are, for the Pfizer vaccine, 16 or older, or for the Moderna vaccine, 18 or older. So these are not pediatric vaccines. These are also, and the governor has noted this, 2-shot regimens. People should receive the second shot of the vaccine at the specified interval. And it's different for the two vaccines. For Pfizer, that's 3 weeks. And for Moderna, it's 4 weeks. So very important information to bear in mind. Governor?
Doctor, thank you very much. Let me turn quickly to schools. We're getting questions, obviously, about schools. Again, main goal, one of our main 3 big goals is get kids back in school March 1. This is our plan for schools. I'd like to talk briefly about what we're going to do in regard to vaccination in schools. And again, we're talking about adults. We're working directly with schools to determine what the vaccination of school personnel looks like locally. We've surveyed the schools. I'm glad to report, as of today, 96% of public school districts have committed to returning to school, at least partially, in person by March 1. So we're happy with that. We'd like to get to 100, but 96% so far have told us, yes, we're willing to do this. Yes, we can do that. So here's the plan. For those districts and other schools that have made this commitment, the state has designated their local education service center as a working partner. These educational service centers, who they're used to working with, are communicating this week with each school district to confirm the final plans. Number 2, school districts are choosing either a retail pharmacy partner that we will secure, the state will secure, secured by the state, or in some cases, they have already decided to partner with a local health department. which they certainly can do. So either way, whether they're partnering with their local health department, or if they want another partner, we will get them the partner with retail pharmacy company. Number three, the administration of vaccines will happen through the school provider partnership and begin, I say begin, the week of February 1st for the first dose. So that does not mean every school will get it on February 1, but we're going to start that during the month of February. This process is going to move forward and then continue on, obviously, for the second shot. Now, we'll have more details of this as we move closer to time, but that's kind of an update on where that is on track. And just to clarify things, these will, by and large, be closed clinics. So in other words, the school personnel will not be competing with those over 80 years of age or 75 or 70 in retail pharmacies or other places. These will be closed clinics. They might be held at a school. They might be held at a central place, and the school personnel will be notified, and the school, of course, will be notified. So closed clinics, not out directly competing with those who are trying to get into hospitals, those who are trying to get into retail pharmacies or others. Let me go, Eric, quickly, key trend slide, and we'll do this real quick. Can't tell whether this is a movement. It certainly is a movement in the right direction. We don't know whether it's a trend or not. The last few days, we've seen fewer cases, about 5,000 here. So we're happy that's down, deaths down. We're seeing hospitalizations down a little bit in the same way with ICU. So again, you know, this is 3 or 4 days. I think we've seen kind of a trend downward, and we hope that that's a trend, but we really don't know about that. I'm going to get back to Dr. Vanderhoff for something. In fact, let's do that right now. Dr. Vanderhoff, I want to ask you, we've heard a lot about the discussion about this variant, this virus variant, and really kind of wanted to understand it. We hear about it coming from the UK. We heard about Ohio State discovering something that's here. So tell us what's going on.
Sure. Thank you, Governor. Well, we're hearing quite a bit about the arrival of more contagious strains of the virus. I am here to affirm that they're here, and therefore we really do need to understand them. At a high level, what we're seeing is that SARS-CoV-2, the virus that causes COVID-19, is changing through a natural process of mutation to become more contagious. And it's happening not just in far-flung corners of the globe, but right here in Ohio. Now, this isn't unexpected. In fact, it's fairly typical viral behavior. What is particularly interesting, however, is that the changes we're seeing internationally and here in Ohio look an awful lot alike. We've all seen the stories about the so-called UK variant. Its most important mutation is a change in the spike protein that appears to make the virus more contagious. Remember, the spike protein is the business end of the virus. It's the tool the virus uses to infect our cells. Recently, the Ohio State University announced it found the same mutation in a sample taken here in Ohio, but, and this is important, the genetic signature of the virus with the mutation was typical for the US, not for the UK. That suggests the mutation arose here and wasn't imported. Ohio State also reported that for a few weeks, most of the virus currently circulating in central Ohio has been yet another strain, a strain the CDC has seen across the Midwest. And this strain has yet another set of mutations to the spike protein, which are also believed to make the virus more contagious. So it's clear, the virus is changing to become more contagious. And experience suggests these more contagious strains will become dominant quickly, maybe just in several weeks, potentially leading to more people getting sick, more people getting hospitalized, and ultimately more people dying. So what can we do? Well, our first line of defense remains our safety measures, wearing masks, staying apart, avoiding crowds, ventilating indoor spaces, frequent hand washing. And we can expect those measures to continue to work against these variants because despite their mutations, they still can't get from me to you without droplet or micro droplet spread. The mechanics of transmission are the same. And of course, we now have vaccination. And the good news is that we remain confident our vaccines will cover even these new strains, both because of vaccine design, which isn't limited by focused spike protein changes. Think of a vaccine making a piece of Velcro that doesn't need to adhere to every spot on the spike protein. And because of recent research out of the University of Texas confirming that the vaccines are working against the new UK mutation. The bottom line is that the virus is doing what many viruses do over time. It's becoming more contagious. And that underlines for us in bold the importance of our safety measures and when it's our turn, getting vaccinated. Governor?
Doctor, thank you. Thank you very much. Well, timing on this, it's already here. This variation is here. It's already done the variation. When do we have any idea when this becomes the more dominant in Ohio?
Well, it was very clear that the virus, when it was detected in the UK, in a matter of about 2 months, went from being a new entrant to being the dominant strain in the UK. So I would have no reason to expect any different timeline here.
So more reason for us to stay focused on what we do, and more reason for us to do absolutely everything we can to get the vaccine in people's arms as quick as we can and people to take the vaccine. So thank you very much. Short time ago, we received word from the CDC that there will be delay in the delivery of Moderna vaccines to 155 Ohio locations. So this is today. These are vaccines that should have been delivered today. There will be a 1-day delay, we are being told. Just to keep this in perspective, this week, delivery should have been Monday, Tuesday, Wednesday. 732 locations in Ohio, pharmacies, hospitals, health departments, et cetera, are getting it. 155, 1-day delay. McKesson, who is a distributor of the Moderna vaccine, was supposed to notify our providers of any delays. Apparently they did not. So our health department is in the process right now of doing that and notifying them. Let me now go to the Lieutenant Governor.
Thanks, Governor. I'm going to shorten my list today. I know we have a lot going on. The issue of cybersecurity is something that I know a lot of people know is a problem, but they really don't understand. It is becoming more of a problem. The recent news of the very relevant cyber attack that occurred related to the SolarWinds software issue have affected upwards of 250 federal agencies and businesses. So we know that that is a big threat. We have a lot of people in the world who are not friends of America, who are looking at cyber attacks as the new way of disrupting our lives, our lifestyles, our economy. I wanted to just take this opportunity to discuss quickly how we're handling cybersecurity in Ohio and in state government, and want to make sure everybody understands our cybersecurity goals. It's the fabric, cybersecurity is the fabric of the Innovate Ohio platform, which we are using to build and improve digital services for our citizens, to keep data safe and follow every industry regulatory standard for how cybersecurity should be handled. Our Smart Cloud initiative in this administration has moved from a policy of encouraging this cloud-centered service to a requirement that state agencies, boards, and commissions go cloud first in upgrading and replacing systems to focus on those cybersecurity standards. We can save costs by improving purchasing power. And last but certainly not least, we can have all of our state employees trained on the cloud technologies and the certifications across the enterprise. So everybody has the same skills, the same applications across that enterprise. This is something that we did when I was Secretary of State of protecting our election system. Now we're doing this all across state government. Why do I bring this up? I want everybody to know that there is a plan and what we're doing inside state government to prepare for this. But there's one key ingredient across our nation, across our state, that we lack, and that's the talent, the people to work in cybersecurity. We need them in state government, business needs them in the private sector. I know when I visit with folks at Wright-Patterson Air Force Base, they talk about the need for our national defense system to have domestically developed talent in cybersecurity. And I want to make sure that everybody is aware of the resources, the job opportunities, and the importance of developing cybersecurity talent in our nation. We have, in our K through 12 system alone, there are 100 information technology industry recognized credentials offered at high schools across Ohio. So as you're thinking about maybe what you're going to do next year, I know that a lot of times this is the time of the year that you think about those things and what's coming next. You may want to check with your high school counselor, your career center, and we will put this out on social media, places that you can identify, ways you can get those industry credentials while still in high school. Higher ed system, 45 institutions of higher learning have almost 100 programs in cybersecurity. You can find out more information about that at ohioc3.org, ohioc3.org. And then I want to talk about Ohio Cyber Range, which was launched in partnership with the University of Cincinnati. There are now 8 cyber ranges around the state of Ohio to give real-world learning experience in K through 12 and college students, as well as internship programs. You can find more information about that at ohiocyberrangeinstitute.org. I raised this because I know we're focused on the virus and the vaccine right now. There are other threats out there that we can be proactive in preventing them from impacting our lives. Cybersecurity is one of them. Please use those resources and think about how you might upskill yourself or your sons, daughters, grandchildren, and give them an opportunity for a great career and help protect our nation and our state. Thanks, Governor.
All right, Lieutenant Governor, thank you. We're ready for questions.
Governor, your first question today is from Jeffrey Reddick at WSYX in Columbus.
Jeff.
Full name today, Governor.
No, I know you got the whole thing, didn't you?
It may seem an oxymoron. I have a quick 3-part question. Have you yet confirmed the federal stockpile of vaccines did not exist last Tuesday when you had talked about them? Is that the cause for the Moderna slowdown? And if the lack of stockpile doesn't slow down Ohio, does it at least keep Ohio from speeding up the vaccine process?
It would appear there's not a stockpile. That's at least what our understanding is. We had a good conversation with the general. He's always been very straightforward with us, and I kind of outlined, what he told us about what to expect in the coming days. So, we're trying to juggle a lot of things and do a lot of things with not enough vaccines. As far as the stockpile and Moderna, I don't know any connection there at all.
Your next question is from Jordan Laird at the Dayton Daily News.
Hi, Governor. So right now, demand far outstrips supply, but that might not always be the case. How is the state working to advertise and educate people on the safety and efficacy of the vaccine, particularly in minority communities that have been hardest hit and might be the most hesitant? We've seen few or zero ads on this subject.
Yeah, ads will start tomorrow. You'll start seeing them on TV. The ads are scheduled to start tomorrow. So it will be a vigorous campaign. I think the thing to remember also, though, is it's not just what we're doing in Ohio. This is something that we would hope to see from the federal government. I've urged the incoming Biden administration to really take a look at this and see if they could be doing some national messaging, not just through what the president would say, but also, frankly, through some paid advertising. So we hope that they, will do that. But we're doing it in Ohio. The ads have been placed, and you'll start seeing them tomorrow. So as far as the minority community, this is very important. We're trying to reach the minority community in a number of ways. First was the decision, frankly, to go into over 700 local places so that we were in every community and that people would not have too far to go. Now, they fill up quick, but we wanted them out there. We can expand that up to potentially, I think we have 1,900 locations that have signed up and said, we're willing to distribute it. If you have the vaccine, we're willing to distribute it. We also are frankly looking at partnering with some African-American churches. We have started down that pathway as well. We think that is important in a way that we can reach African-Americans. And the messaging, we're working on specifically on messaging, just as we've done in regard to the mask, where we've gone on radio, specifically targeted African Americans. We'll continue to do that, and we'll do that in regard to the vaccine.
The next question today is from John Reed from Gongwer.
Good afternoon, Governor.
Hey, John.
Are Ohio prison inmates who are 80 and older able to access the vaccine? And will that next week when they're 75 and older?
Yes. We're treating all Ohioans the same. If you hit a mark on the age, you become eligible. So, we are doing that, and we're treating everybody the same, the best we can, anyway.
Next question is from Jim Province at the Toledo Blade.
Hi again, Governor.
Hey, Jim.
We've had another case in Lucas County where a group outside the priorities you've laid out, in this case about 30 police officers in the city of Oregon, have received vaccines when the Toledo clinic found that it had extra doses. Why are we seeing such disparities in how this is being applied locally, and what can we do to change that?
Well, first of all, we're a local government state. We have 113 local health departments. We have many hospitals. So this is being distributed this week, for example, well over 700 different locations. We've given them strict guidelines. We have made this very, very clear, but every once in a while I'll read something in the newspaper that's somebody got it, and I kind of scratch my head and say, well, how did that happen? And please keep in mind, it's not that we don't want police officers to get it, or we don't want embalmers to get it, or it's not it at all. We're just trying to go by the data and by the science. We have a limited resource, and we're putting this out in a prioritization based upon the three component parts that we talked about. And the principal one is saving lives. You got the schools, we're doing them. And school personnel are getting that because we want schools open. We got medical personnel because we got to protect them. But we've made it clear to the hospitals, when we're talking about medical personnel, we're talking about frontline. We're talking about people who are dealing directly with COVID patients. We're talking directly people who are really, really the most at risk. We've made it clear to all the providers, the last thing we want you to do is to waste any. So I'm not going to criticize a decision that was made by a health department or whoever was doing it, where they had extra doses and they decided to go to police officers. I'm not going to criticize them. What we've told that we don't want them wasted, and we want them in people's arms. But what we've asked them to do is not only prioritize it and only be going in and trying to vaccinate people who fit the criteria as we've outlined, but to plan ahead. And so if they have more left over, which sometimes you do, you can't hit it perfectly. And this is a fungible, this is a product that goes away, that can go away on you and not be usable. We want them to have a backup. We would ask them to make the backup 1A or 1B people. If they can't do that, we're not going to, yell at them or anything. And if they're getting in people's arms, that's fine. But we really, really want, for the most efficient way to save lives and to save the most lives and protect the most people, adhering to these guidelines is really, really the way to do it.
Next question is from Scott Hallis at the Xenia Daily Gazette.
Hi, Governor. How are you today?
Hey, Scott.
I apologize if this is a long-winded question, but each week more and more people are going to be, added to the list of those who are eligible to get the vaccine, and the list grows. The vaccine is not going to grow at the same rate. What happens to the folks who've already received their first dose and they need to have that second dose within a certain time frame? Are they going to get priority? What happens if there's not enough for them?
Yes, a good question. Doses are designated first dose and second dose. They're fungible. I mean, they can be moved around, but, we are very focused on making sure that there's a priority. And the way the system is set up, there is a priority for that second dose. So again, with the one, it's 3 weeks. The other is 4 weeks. There's a window in there. But second doses, yes, that's set aside. So when you hear me talk about doses coming into Ohio, I'm generally talking about first doses, because the second doses are coming in. We're just not talking about them. We're not putting a spotlight on them, but that is occurring. And the way the federal system is set up, that should track, that should track very, very nicely. So second doses will be taken care of. You make a good point, Scott. When we talk about, we opened the 80 group up, and we thought that there would be a big uptake. We thought people would be very interested. But remember, we were coming off nursing homes, usually a younger group, of the workers. I'm talking about the workers now. And, where we're only getting 40%. But we felt that when we started people 80 and older, 75, 70 and older, that it would be a significant portion would take it. That has proven to be absolutely true. And when I talked to health commissioners this morning, when I've talked to our hospitals the day before, it was clear from talking to them that demand is really there for people 80 and over. So, one of the things that we may have to do, we're not going to announce that today, but one of the things we may have to do is pause the numbers and because what you don't want to is, again, you're trying to figure out how you save the most lives. And so we know statistically vaccinating a 90-year-old, their rate of death is going to be higher than a 65-year-old, just is. So we may have to slow down the dropping of the age. Everybody's going to eventually get it, but we're trying to do this in as equitable way as we can, and in a way that is targeted to saving the most lives. So we're set to go next week on 75. We intend to do that. But we may slow that down beyond that. We're just not sure yet. We got to talk to all our partners who are putting the vaccine out. They're the ones who are making it happen every day, and we got to kind of get a feel from them, what they're seeing out in the field. And we're going to know more, as we go through this week and see what happens this week.
Next question is from Kenny Bass at WCHS.
Hey, Kenny.
All right, we'll try to get back
West
to
Virginia.
Kenny.
Listen, Kenny in West Virginia. We'll get you, Kenny.
Yeah, we'll get back to Kenny in West Virginia. Matthew Herchick at WCMH.
Good afternoon, Governor. You mentioned your conversations with the Biden campaign in regards to advertising. As he gets set to take office tomorrow, what tangible changes might we see as his administration takes over in terms of the vaccine that may help expedite the rollout of this?
Well, I really don't know. I mean, and just to clarify, I really didn't have a direct conversation. We put this in a letter. They asked us for ideas, and we sent a letter. That was just one of the ideas that we had. As far as what changes, I would just really in our conversations, what they have told us has been very similar to what they've said publicly. And we've looked at the goals that they have, but I don't have really anything to add to that. Most of these conversations, frankly, were more of them listening to what ideas that we had and kind of what we were, they were careful to try to find out from us what we're seeing on the ground, how things are moving. They talked about big vaccination sites. One of the things that, they're focused on, they also are told us that they're believers in going through local pharmacies, which we're doing. And we're going to continue actually to expand that with local pharmacies in the future as we get more vaccine.
Next question is from Alex Ebert at Bloomberg.
Good afternoon, Governor. In October, your administration stalled the implementation of work requirements for Medicaid beneficiaries that was set to begin this year. Can you tell me if the administration plans on scrapping that now that Biden is taking over? There's been talk about CMS withdrawing permissions for states to implement those. And I know that your administration was also sensitive to the fact that unemployment issues were difficult for folks during the pandemic.
Yeah.
Thank you.
Yeah, we're going to wait and see what their new regulations are, and we'll certainly adapt to that. So we have to see where what they're going to do, what we're allowed to do, and not only what we're allowed to do, but what we're going to be required to do. So yeah, we're waiting to see that, and we'll report back as soon as we know something.
Next question is from Marty Schladen at the Ohio Capital Journal.
Hey, Marty.
Good afternoon, Governor. What are the 155 locations that are finding that they're going to have a delay in getting the vaccine? What sort of some problems might that cause? And is McKesson going to face any sort of sanction for failing in its notification duties?
Well, I don't know about sanctions. We've complained about it and said they need to be, up on that. And when they see that there's going to be a delay, they need to, to really notify immediately. Look, the implications are simply this, that you, if you're a pharmacy or if you're a health department, you're a doctor and you think you're getting a shipment in one day and you're going to vaccinate the next, and you've got a scheduled appointment, you're going to have to call all those people and reschedule them. And so, what we hope they will do is just flip days and go to the next day that they can do that. But each one will have to adjust based upon, when it gets there and, what they can do. But that's what we would expect. We don't, with basically 100,000 to spread around the state this week and, over 700 places, as you can tell, nobody has a lot. So these generally will be places that they will reschedule 50, 100, maybe 200. That's very inconvenient. It's very inconvenient for the people who get the calls. Nothing we can do about it. They ship it when they ship it. One of the things that frankly we've asked, is if earlier notice about when shipment is taking place and where shipment is taking place. We give them every week. We give them on Thursday and Friday. We give them the locations to ship it to. But then it's a couple of days until, Moderna is shipping on Monday, Tuesday, and Wednesday. So we never know which places they're going until usually Sunday when they're notifying that provider, here's when it's coming. It's coming Monday, or it's coming Tuesday, or it's coming Wednesday. So this is an added wrinkle for those providers.
Next question is from Andy Chow at the State House News Bureau.
Andy.
Hi, Governor. I'm wondering if you could address the challenges that seniors and older people face when it comes to trying to sign up and trying to access the vaccine, especially seniors who might have disabilities. What is being done to help connect them with getting to the site, being able to sign up, sort of those logistical issues?
Yeah, and that's a good question, Andy. We're going to assess that after the first week. We stay in close contact with our providers. We stay in close contact with our health departments. close contact with our hospitals. We're going to look at this and see, as I said last week, it's a work in progress, and we're going to continue to evaluate it. What we found in discussions with health departments, particularly, but also some other providers, is they're doing some of it that they're doing by phone. You know, they're people are able, in some cases, not every case, but able to call in by phone and, you know, do not have to go up online. Now, a lot of them, the hospitals generally, particularly the bigger hospitals, are doing it online, but you're seeing some health departments that are really doing a phenomenal outreach job. And so we'll evaluate that, and, you know, we're going to constantly look to see access of availability. And we're very, very sensitive to that. We can understand you got somebody who's 90 years of age, is probably maybe not going on their computer, maybe not pulling this information down. And so, we want to continue to evaluate how we're reaching them. The tug and pull is we urgently want to get it out, but at the same time, we want to make it as convenient as we can. And we want to make sure we're not missing any group of people who cannot access the system. So those are the things we continue to evaluate.
Governor, can I add on that one that Ursel McElroy at the Ohio Department of Aging is working with the local area agency, local aging agencies to make sure that we're doing outreach through all of those connections. So the Department of Aging team is really working on those local connections to find people and help them navigate that process.
Yeah, and I was happy to see, as you saw, the example in Athens County, going out. So that was, the one county that was going out. It was just great. They're into someone's home. So.
Next question today is from Jackie Borchard at the Cincinnati Enquirer.
Good afternoon, Governor. Last week, you talked a lot about preparing for potential protests in Columbus over the weekend. And I guess, fortunately, there were very few protesters that showed up at the State House on Sunday. Was your decision to deploy the National Guard an overreaction, or would you have done anything differently?
Well, Jackie, you never know exactly what's going to happen. We had credible threats directed at Ohio. I won't go into more details, but that we had that. Frankly, I leave the decision and the recommendation. I make the order, but the recommendation of how many National Guard to deploy, how many members of the Ohio State Patrol to deploy to the professionals. I questioned them, I talked to them, but this was the numbers that we have were their recommendations. After what we saw in Washington, D.C., I think it would have been negligent for me not to react that way. I think you're seeing governors around the country doing the same thing. And let me just say, we're not through this yet. We have an inauguration that's coming up tomorrow. And, we don't know what's going to happen. We hope nothing happens. We hope it's as peaceful as it was on Sunday in our Capitol. But this is always the question. And what we do know is when you have enough forces there, the likelihood of violence goes down. The likelihood that you'll have a police officer, you'll have a member of the patrol, member of the guard who will have to use force goes down. Numbers matter a lot. And so, I think we, based on what we knew at the time, I think we made the right decision.
Next question is from Kevin Landers at 10 TV.
Hello, Governor.
Hey, Kevin.
Hello, Governor. Can you hear me? Hey, good.
Yes, sir. I can hear you.
Governor, there are people who have received, great. Governor, there are people in the state who have received their second COVID-19 shot, but that data isn't on the ODH website. Do you know how long before we'll be able to see that data? And on the topic of the vaccine, the 1C group contains people who are smokers. Are those who smoke going to be given priority over those who do not?
I've not seen any indication and anything coming out from our team or anyone else about smokers being given preference. I'm not aware of that. As far as the second dose, I know they were working on that. I was talking to the director today, in fact, within the last hour specifically about that. So we would hope that that will be up in the next several days.
Next question today is from Ben Schwartz at WCPO.
Hey, Ben.
Hi, Governor. The most recent stimulus bill from the federal government gave states the ability to forgive overpayments for pandemic unemployment benefits. Since more than 162,000 Ohioans were overpaid by ODJFS, have you directed the agency to waive repayments?
Yeah, the director is looking into that, and we will have a discussion shortly, and we'll report back.
Next question is from Laura Hancock at the Cleveland Plain Dealer.
Yes, Governor, following up on the previous question, we were wondering if you guys had any tracking of how many of false claims have been taken out on Ohioans. And then also, I was wondering, is there any way you can add to the website, this is a suggestion, like what Ohio is receiving in terms of vaccines so we can kind of keep track of that along with what is being given out?
Sure. And let me take that one for a moment. This is, as you know, quite complex, and I don't want to bore everyone, but it is quite complex simply because we are a high number of nursing home state. We prioritize nursing homes because that's where we were seeing the most deaths. We have close to 1,000 nursing homes in the state of Ohio. So, we set that aside. So if you look at some counts, those are already counted as coming out to us. They're not physically come out to us. The way they're actually pulled down by our pharmacy partners as they need them. And so they really are not all in the state. They're not sitting there any place, but they show up on the data. So that's what makes that a little on the complicated side. Second, you have second doses that are flowing into the state. And the second doses, they want to make sure they're here in time. The way the system is set up, they want to make sure. And so it's my understanding they allow, when they're shipped, they basically allow a week before they're going to be needed. So again, you've got those that you have to factor in somehow in any kind of discussion. As far as your other question about false claims, I don't know if I mentioned this before, but a few weeks ago, Fran and I got some correspondence from the state of Ohio that we had filed an unemployment claim. So, we know that this is widespread. We weren't sure exactly what what anyone was trying to accomplish there with us, but we know that there's been a lot of those. So we'll get the director on here sometime and give you kind of a rundown, or we'll check on that as far as the size of these false claims. John, you have anything on that?
Yeah, I had a false claim filed in my name as well. And I will tell you, though, we're trying to track down that exact number. We've made that request so that we get a scope for the size of the attempt at fraud. I don't want to give a number out, but I can tell you from the preliminary discussions we have, it's a pretty big number. But I want to say about this that that's why a lot of times it takes a little longer to track this down because, well, and to help people get access to their unemployment compensation, because we've had so many false claims, they have to track every single one of them down to make sure that it's legitimate, which adds time. Why I bring up the cyber attack issue today, this is all part of that. The identity theft issues, everything around that is, we're getting a lot of it right now. And it's made the job of getting legitimate benefits out to people harder and doing everything that we can do to protect against, losing any tax dollars out there to people who are filing false claims.
Okay, your next question is from Dan DeRose at WOIO.
Good afternoon, Governor.
Hey, Dan.
There are roughly 21 hours left in the Trump presidency. I wonder if we can get your overall impression of Operation Warp Speed. We are nowhere near the goals that the president had set for the end of year for as many, for 20 million individuals being vaccinated by the end of the year. We're way beyond that now. And the public may have this idea that while they haven't seen President Trump, that perhaps for the last couple of weeks, the administration has been checked out. Is that your experience with Warp Speed, or are there still meaningful meetings and discussions going on? And again, your overall impression of Operation Warp Speed.
Yeah, I told you we had just a couple of days ago a good conversation with General Perna. So, you know, that there's a continuity there. He's there. He's answering questions. He's going to be there after the Biden administration takes office at 12 noon tomorrow. Look, I think history is going to have to write that story. I'm not sure that I'm the best judge of that when you're sort of in the battle every single day. Maybe you don't have the big perspective. I think that, you know, the development of this vaccine and the push that was done to get it done with the 2 vaccines that we have, a lot of people get a lot of credit for that. You know, it happened, certainly happened under the President Trump's watch. So, you know, I think they get some credit for that. It happened very, very quickly, you know, unprecedented. We got a great scientist and many people who've just been working phenomenally, but to have the production going on at the same time before, you know, the drug was totally tested and approved, I think was a positive thing. So, you know, we've kind of indicated today some of the things that, you know, having more notice about when it comes out would be good, but you can only ship what you have. You can only ship the product that you have. And so I'm not, you know, as far as I'm concerned, shipment, you know, there's some problems connected with it, maybe like a delay, but we can adjust to those things. I mean, what I have said and what I've said to the incoming Biden administration is, look, you ask us what we need, we can tell you a number of things, but what we really need is just more vaccine. We can adjust. We can do, you know, we can handle this. We can figure out how to go over bumps and logistic problems and other things, and we can work our way through problems. It's kind of what we do. But what we can't do is, you know, produce these and get more. So, you know, as we look to the future, we have no indication that this thing is going to turn up right away. We hope when Johnson & Johnson comes on, and we hope they come on soon, March, we hope, that's going to make a big difference.
Next question is from Trevor Peters at WXIX.
Hi, Governor. With each state vaccinating age groups at their own timeline, if access to a vaccine is quicker in Ohio, will the state allow residents who may live across state borders to make an appointment with an Ohio provider? And then vice versa, will the state encourage, say, a 60-year-old Cincinnati resident to go into Northern Kentucky if their doctor's there to get the vaccine if they are eligible to get it there faster?
Well, I'm told we're already really seeing that. We're seeing people, you know, who live along the border, whether it's Kentucky or Indiana and Michigan, West Virginia. We're already seeing people on both sides going across. And so it's something that, you know, I'm going to talk to our neighboring governors about just to get, you know, their thoughts about it. If you look at our data, you know, we do show out-of-state residents. Now, what happened initially, you were seeing those because they worked in an Ohio hospital. And that was just natural. The hospital was taking care of the people who work in that hospital, who are taking care of Ohioans. And some of those people might have lived in West Virginia, or they might have lived in Pennsylvania, and they come across. So some of this is just natural, organic, is just going to happen. So I'm going to, you know, we're going to talk with the different governors and see, you know, how, if there's anything in particular that we need to do about that. I'm not sure that there really is, but we'll have that conversation.
Next question is from Danny Eldridge at Hannah News.
Hello, Governor.
Danny.
Can you talk a little bit about why you chose Justice French to lead the Ohio Department of Insurance? What kind of experience does she have in that area?
Yeah, we'll be putting out a full release. I was going to go into that today, but I ran out of basically time, and we had to kind of, as you could see, we had a big agenda to cover here anyway. Look, she's someone who I've known for a long time. She's very well respected. She certainly handled some cases in that area. She does have some background in that, but she's just, a very solid, good, smart, dedicated public servant. And when we found out that she had an interest in that position, as you know, she was also nominated by statutory group to be one of the people we would consider for PUCO. But we had been thinking about her for this position. I talked with her yesterday. I talked to her Sunday about it. And one of the things that I ask her one of the things that I care a lot about and ask her to really focus on is equity in regard to insurance coverage for people with mental health problems and people with drug problems. And I've asked her, that was really the one specific thing as far as policy issues I wanted her to look at, take a hard look at, give us her best judgment on, and to be constantly aware that this is something that I think, while we just passed a bill, we just signed a bill, we think that's going to be helpful, but we have to constantly look at this and see how it's working in the real world. And that was my mission charge to her.
Next question is from Bob Jones at WEWS.
Bob.
All right, we'll try to go back to Bob. Next question, Bryn Caswell from Fox 45. Oh, yep, there you are.
Yep, Bob.
Sorry about that. Don't know what
Okay.
happened. Some independent pharmacies feel frustrated and left out of the vaccine rollout because many doses are going to the big chains and stores. Why is that? And what do you tell the independent pharmacists? Because they say they are trained and ready to go, but don't have anything to work with.
We have included, I believe, some independent pharmacists, and it's interesting. I had this specific discussion with my team yesterday, and I said, we need to involve more independent pharmacists. My wife and I grew up in a little town, and we had an independent pharmacist, Herbal & Johnson Drugs, Yellow Springs, Ohio, and we are also benefit here in Cedarville with a local pharmacy run by Cedarville University. So we know local pharmacists, they're very, very important. And I've instructed our team to make sure they're more included.
Next question now to Bryn Caswell at Fox 45.
Hello, Governor. With the Trump administration saying there is no stockpile and that it's already been distributed, when you heard this news, what was your initial reaction? And are you concerned there will not be enough vaccines for those second round shots for Ohioans within that recommended time frame? And having said this, with the Johnson & Johnson vaccine only needing one dose, do you hope in March that will be the boost Ohio needs to make vaccinations go a little quicker?
Well, I hope it'll be the boost. I think it will be. I know it'll be a big boost when we get it. As far as the second shots, I have no indication. We have no indication that we're going to have a problem with second shots. So, we're monitoring this. We're looking at this. The federal government has been scrupulous, as far as we can tell, in making sure those second shots are following, that that is being, in fact, tracked. So again, when I talk about this, I usually look at the first shots, with the belief, and so far it's worked, that the federal government has these other ones coming in behind them. And so we have no indication that we are going to have a problem with second shots coming in an appropriate time.
Next question is Justin Dennis from Mahoning Matters.
Hey, Justin.
Good afternoon, Governor. Thanks as always for briefing us. Expanding on your talks with the Biden administration, do you expect the federal government to be more hands-on in distribution in the future, perhaps if FEMA or the National Guard came on board to get involved with public distribution? And how would you feel about that? And is there anything specifically you'd like to see the federal government help with in terms of logistics?
Yeah, they've given some indication that FEMA may be more involved. As far as the Guard, we've had good leeway with the Trump administration as far as the Guard. As you know, we've used the Guard for things throughout this. They continue to be directly involved in testing. They enable us to go into minority communities, underserved areas of the state of Ohio. They've been involved directly in regard to food banks. So GUARD has been an integral part. They will continue to be an integral part as far as we know as we're going forward. I mean, as far as we go forward, the GUARD will continue to be very, very important. And that's something that we, again, in the letter I sent, talked about, the importance of the GUARD.
Next question is from Tom Jackson at Ogden News.
Tom.
Hi, Governor. Thanks for taking my question. Governor, have any decisions been made yet about who's going to be in Group 1C when you wrap up Group 1B?
Tom, that's a good question. We're certainly thinking a lot about this. Candidly, when you look at 1A and 1B, it's over 3 million people. And, we're working through this, but we're more focused, frankly, on where we are today. That will constitute over a fourth of the state of Ohio when we get through those groups. So we don't think there's any reason to make an announcement yet. Our concern is also, frankly, if we make an announcement about what's in 1C, what people sometimes hear is, oh, that's my group. And, we've seen this throughout. We'll announce 80-year-olds and we got 65-year-olds calling. And I understand that. Not everyone's watching this press conference and, I get it. So we're trying to be really careful to tell people, look, our goals are everybody will get it that wants it. No one will be forced to take it. We'll get it out just as fast as we can. We don't know exactly where herd immunity lies. I'll leave that up to the experts, but we got to hit herd immunity as quick as we can. We know it's going to be months. And the groups that we have targeted so far are the groups where we think we can get kids back in school. We protect our first responders, our medical people, as well as our EMS people, and we save lives. And so that's been our focus. That remains our focus. And, we're focused on, moving through as quickly as we can, but we know at the rate this vaccine is coming in, it's going to be a long time before we get through 1A and 1B.
Next question is from Jim Oddie at WHIO.
Hey, Jim.
Hey, Governor, will you be watching the inauguration tomorrow? And what are your expectations? How important is it to get this new administration off the ground and to get through this without any additional violence? How important to you?
Well, it's very important. Yes, I'll be watching. I think I've watched every inaugural. When I was in Congress, I was there in person. And I decided not to go this time. Felt I needed to stay here. But sure, it's very important for tomorrow to go well. I don't care if you're Democrat, Republican, liberal, conservative, libertarian, whatever you are, tomorrow for this country needs to go well. And we need not to see violence. And I think that the officials, federal government is doing everything they can to assure that, to make sure it is a safe, it is something that American people can look at and all be brought together, at least for a short period of time, as we make a peaceful transfer of power. And it's something that we've done for over 200 years.
Next question is from Ashley Kirkland at WLWT.
Hey, Governor, what is the state doing to help prepare hospitals for a potential surge with the new strain of the virus and possibly infecting more people because it's so easily spread?
Well, I think Dr. Vanderhoff outlined really what we need to do. It's just a cautionary warning that it's here, and if it follows the pattern, as we've seen in other countries like the UK, within 2 months it becomes the dominant strain. And I think that should, if anybody needs an incentive to get the vaccine, that should do it. We think the vaccine will work against this variant mutation. We know it will. All indication is it will work. The one down thing, and one thing we have to worry about is believed to be much more contagious, and more contagious from what we've already been dealing with, something that already was contagious. So I think, the urgency of getting people vaccinated, our most vulnerable, as quickly as we can. I know when I talked to Dr. Vanderhoff about that, and he, has advised me of this, it just increases the sense of urgency, if it could even be any higher, to we got to get people vaccinated. And people, have to continue to wear masks, continue to distance, continue to be careful. I mean, we're right in the throes of this, and we can't walk away from it.
Governor, your final question of the day is from Luis Gill at Ohio Latino TV.
Hello, Governor.
How you doing?
Good.
See ya.
Thank you so much for having us, Governor. Governor, have you taken different steps from the beginning? We start speaking back at the beginning with this coronavirus for the minority communities. At the time, there were some, the virus was advancing very quickly in the minority community, African American, Latino. Any additional steps you have taken for this time for the vaccination to take place and so on?
Yeah, very important. And you'll see when you look at our page every day, and I look at it every single day, you'll see what percentage of the population of the state of Latino, what percentage of the state of African American are we hitting, same way as white. And Asian as well is broken down several different areas. So we're monitoring that. I know when we were talking to some of the mayors today, one of the things that we continue to focus on is what our urban communities are doing to do outreach and to make sure underserved populations are in fact served. So it's something we're monitoring very closely, and it's something that we take very, very seriously. So it's a work in progress, and it's something that is very measurable. We had a kind of glitch for a while. Some people were not writing down what category people went into. So we got a whole bunch of unknown, but I think we've got that everyone will make that notation. And so that tells us, frankly, how well we're doing. And so we're going to continue to do that and continue to reach out. And we're going to go into different communities. One of the communities that we're concerned about, of course, is migrant workers, seasonal workers, who many times are Latino. And this is one of the things we talked with the Biden administration about as well, because you might have someone coming up from Texas, you might have somebody coming from Florida, and so where should they be getting a vaccine, and how should this be doing? So it's something. It's a work in progress, and we'll continue to report on it. Thank you all very much. Look forward to seeing everyone on Thursday. Let's pray we have a good inaugural tomorrow with the new president and the new vice president. Thank you all very much.